What's going on, everyone? Happy Friday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, September 8th, 2023. We do have multiple new COVID outbreaks to talk about today. First off, positive COVID cases are sweeping across the University of North Carolina's Asheville campus. There are also COVID cases that are rising in North Carolina Central University. So that's two outbreaks that are ongoing right now in North Carolina. Then we move over to Texas. In Texas, a team has canceled its entire season. This is high school football. A team has canceled its entire season due to COVID-19, and it says here they just have a number of players right now who are positive for COVID. It's also impacting the cheerleaders as well, and they were trying to avoid a six-man roster. I don't even know how that would work on a football team. Just six players on a team. Yeah, you got me. It mentions something. It's switching to six-man football. I've never heard of such a thing, but apparently it's something that can happen. But nonetheless, their season's canceled. All the teams they were supposed to play automatically get a win because they essentially forfeited the entire season. Then we move over to this. We've seen numerous different animals since 2020 test positive. We know white-tailed deer can catch COVID. We've seen zoo animals. There was something up at the Bronx Zoo, I believe that's where it is, in New York City, back in 2020, where I believe it was a lion or a tiger that tested positive. I don't quite remember. Someone post it down below if you do remember. But in this case, a gorilla has tested positive at the Little Rock Zoo. Officials with the Little Rock Zoo said that its silverback gorilla has tested positive for COVID-19. So this can happen, and we'll probably continue to see this happen. Now moving on to this. This is something a tweet on Twitter I just read a few minutes ago. This really bothers me. This is very concerning, my friends. A friend, this is from Miles W. Griffiths, and they put, a friend who works in healthcare has a coworker that went to the Beyonce concert over the weekend. The coworker was sick all day, but didn't test until the end of the day. They saw numerous patients unmasked, so they went to work in a healthcare setting, saw patients, and didn't even bother to put, one of these masks on. It's just ridiculous. So who knows how many people they just infected? Who knows how many people were immune compromised? I mean, let's just say they saw 20 patients, right? Let's say 10 of them get COVID. Let's say each of them have 3 people in the household. Okay, so 10 caught it, 3 people in the household, all 3 get that. Well, that 10 then turned into 30 cases just because one person went to work. And yes, it does say here they tested positive for COVID. So this person tested positive for COVID, and hey, that could turn into 30. It could turn into more than 30 cases. Who knows how many cases this is going to turn into? And then they pass it on. It's like a game of multiplication. That's how COVID works. 1 times 1 equals 1. 2 times 2 equals 4. 4 times 2 equals 8. You get the idea here. It just goes on and on. I mean, 1 plus 1 equals 2. 2 plus 2 equals 4. Well, it just keeps multiplying. And that's why we're at where we are. This is why there are so many various different variants. I'll show you the variants in a little bit. Let's take a look at air quality. It's important that we take a look at air quality because air quality can impact your health. And taking a look at air quality across the country, generally poor air qualities on much of the East Coast. I mean, it's not extremely bad, but it's bad enough. And then you can see here in the plains, got some bad air quality. We got some greens here in the west. That's good, but California, we do have a lot of yellows, and we still have some really unhealthy air qualities in Northern California, Southern Oregon. So it's something we're watching. Also in the east, New England through Nova Scotia, a lot more orange starting to show up at this time, which is not good. Let's take a look at the cases of that BA 2.86 variant. Yes, it's now over 100. There's 105 total. Here's where the most are at, though. United Kingdom, 36. South Africa, 16. Denmark, 12. And then, of course, United States now has 8 cases of it. Taking a look at heat-related illnesses, we know the highest of this is in the southeast, in the south central, and in the Great Lakes. I expect that we're definitely going to see this increase for the I-95 corridor from D.C. on up to New York. I'll show you why in a little bit, because call volume is just way up. Especially like here in Philadelphia, call volume is up at this time. Alright, on my other channel, we are continuing to track Hurricane Lee. I will be doing an update on Hurricane Lee in just a few hours, so check that down below. It'll be down below. Climate data report for all the updates on that. Alright, Chicago this week. We do know hospitalizations continue to rise, cases and deaths continue to rise. Emergency visits were down ever so slightly, so that is a good thing. And now we move on to, let's take a look at Walgreens for this week. 40.9% positivity this week. Prior week was 43.6%. Total tests, 6,637. Prior week was 6,273. All right, drum roll please. I have to refresh this. BioBot. Yeah, it should be hopefully coming in with an update today, and let's see what the new update says for BioBot here. Alright, here we go. Look at this. It's kind of like a roller coaster now. But as you can see, the Midwest continues to rise. The West is dropping ever so slightly. The South is dropping ever so slightly, and the Northeast is continuing to rise slightly. We'll have to see if that remains the case. They've been updating with corrections on Tuesday. We'll see if there's another correction on Tuesday. Coming down here, taking a look at EG.5 is 21.4% of the variance. XBB.1.16 does lead here by 28.8%. But we know at the CDC, let's take a look here. CDC, EG.5 is at 21.5%. FL 1.5.1 is at 14.5%. XBB.1.16 is at 8.9%. And then this wild card, HV.1 variant, which last week just popped up out of nowhere, is at 5.1%. All right, coming over to this wastewater. We'll have our wastewater update. I think we will on Sunday. I might even just do it tomorrow. Stay tuned to my Twitter for that information. It's possible we may do the Sunday wastewater update a day early this week. I'm going to be busy on Sunday. It's the first day of football, so I'm going to be out delivering most of the day on Sunday. I don't know. Stay tuned. We may even just release it early in the morning on Sunday, like around 7, 8 o'clock in the morning. All right, taking a look at these numbers, they're not good. We're still seeing a high number of orange and red sites. Let's go over them all. New sites, 88. 0 to 19% COVID detected, 99. 20 to 39% COVID detected, 351. Blue, this light shade of blue, 40 to 59% COVID detected, 431. The orange, which is bad, 60 to 79% COVID detected, 322 sites. 80 to 100% COVID detected, 109 sites. So orange and red, they continue to be high. Orange is down ever so slightly. Red is up ever so slightly. Alrighty, moving on now. We know that hospitalizations continue to rise in the United States. There were 17,418 admissions last week. That's really bad. All right, let's take a look at a few of those wastewater sites now that show other things besides just COVID. And how about today we go up to the area near Detroit, and we can see the COVID levels in Detroit dropping ever so slightly. Influenza not detected, RSV not detected, HMPV not detected, Mpox not detected, and norovirus is dropping at this time. Now let's go over to the Northeast. We haven't taken a look at the Northeast in a few days. Let's see what's going on in Boston. I am curious. COVID in Boston is dropping at this time. Influenza, a little bit of influenza was detected. Now it has dropped. And taking a look at RSV, RSV is starting to rise. Remember, folks, there is now an RSV vaccine, and pretty soon, if not already, you should be able to get that RSV vaccine. I suggest that you do that if you can. I don't know what the availability of age groups is, but when I find out more on that, I will let you know. And if you know anything, by all means, educate me. I'm always open to being educated by you guys down below. So HMPV is dropping. At this time, there's none being detected right now. Mpox not detected, and norovirus is dropping at this time. Alrighty, moving on. Philadelphia's EMS instance, we do want to update this. That was actually for Wednesday. Here is Thursday. Thursday was down ever so slightly to 809 incidents today. But again, that's over 800. That's concerning. That's 3 days in a row now over 800. And the Philadelphia suburbs have been really busy today. A little less busy in Montgomery County right now. How about Chester County? What's going on there? Still quite busy in Chester County. Like I said, it's just been a really busy day in the suburbs. Take a look at New Jersey. Hospitalizations are up yet again. They continue to rise there. Take a look at this. You can see on the chart now. I mean, they were already going up at a steady pace. Now they're just rapidly going up. 489 people in the hospital in New Jersey, 18 people on a ventilator. In the ICU, 47 discharges. There were 54 discharges on the most recent update. All right, let's take a look at LA. You can see in LA, which means Los Angeles, California, not Louisiana, you can see the test positivity rate. It continues to rise at this time. You can see now it is, wow, it is almost at 16%. That's not good. Let's come down here to deaths. Deaths at this time are not rising just yet, but what we are seeing rise are the hospitalizations, and there is some good news here. Look at this. The hospitalizations, they were rising for a long-term trend for most of the summer. They're starting to level off now. That's a sign that maybe, just maybe, Los Angeles is showing signs of a peak. I don't want to play peakologist like we know some people do on Twitter, but it is starting to level off. So that is some good news. And let's see, any other data we can report on for Los Angeles? Let's see here. Here's testing. You can see testing has dropped a little bit as well, which probably would explain why positivity is still going up. And they just do total cases, 3.7 million cases. New York State, speaking of total cases, yikes, almost 4,000 new cases in New York State today, 3,805. This does include reinfections at this time. Taking a look at hospitalizations, just an ever so slight drop in hospitalizations in New York State today, 1,390. People in the ICU, 141. We'll be looking next week to see if New York State hospitalizations slow down soon. One thing I did just notice here, that 141 people in the ICU, that's up pretty significantly from yesterday's 126. So ICUs do continue to rise. Let's just take a look at admissions as well. Yes, admissions are still higher than any point for most of last week, aside from last Tuesday's update. But the latter part of the week was never as high as they are today. All right, moving on now. We know Texas cases. There were over 30,000 cases in Texas this week. They have 1,400 people in the hospital. We know Ohio this week had 8,600 cases, 163 people admitted to the hospital. Then we come over here to, what is this, Colorado. Colorado was up this week on cases. Not good, 2,110 cases. And now California itself, 13.7% positivity. Deaths, they're averaging 11 a day. New hospital admissions, they're averaging 383 a day. So hospital admissions in California, they are dropping ever so slightly at this time. So again, California may be starting to slow down. I don't know. Let's see what next week says. And test positivity, remember, it's still rising there. And deaths also. If you look at the chart, deaths are starting to rise. Remember, deaths are always the last lagging indicator. All right. Let's move to the international update, and then we do have to take a look at a little bit of flu data. Then that'll be it for today. Taking a look here internationally, let's refresh this. Internationally today, you can see Russia cases are up 98%, deaths are up 45%, Romania cases up 43%, deaths up 200%. That works out to 12 versus 4. Belgium cases are up 26%. Then we come down here to Mako, where cases are up 11%. Hong Kong, cases up 40%. Deaths are down 38%. Poland, cases up 26%. Deaths down 50%. Bulgaria, cases are up 24%. Deaths are up 100%. 4 versus 2. India, cases up 20% now. And Morocco, cases are up 92%. zero deaths reported. Denmark now sees a 14% increase in cases, a 120% increase in deaths, 11 versus 5. Alrighty, now taking a look at the latest flu update, which just came in today. For some reason, New York City did not report, but taking a look, Mississippi is now in a moderate level, and we do see several other areas that are in the highest shade for the low level, meaning they're going to go to moderate relatively soon. That's not good. Puerto Rico is actually in the minimal category. We have not seen that for a long time. And California, while still in the minimal category, it is going to probably cross over to low relatively soon. Alrighty guys, real quick today before we end our pandemic update. There's a lot of buzz right now on Twitter about a new change in terms of service. And with that, it sounds like Twitter, by the end of September, is going to be able to sell your data. Yeah, that's a really bad thing, isn't it? It's actually concerning. I'm hearing people say they're going to be leaving Twitter at the end of this month. Well, first off, I want to say, as of right now, I don't plan to leave Twitter. Stay tuned. We'll see what happens. But if I should ever leave Twitter, this is where you will find me. My own website. People ask, am I going to go to Mastodon? Am I going to go to Threads? Okay, I do have a Threads account for weather-related stuff. I haven't posted on it in a few weeks. And Mastodon, no, I don't intend to go there. I have my own website. I have no reason to go to those places. I post stuff on my own website. I post news stories. And here's the thing about my website. I recently made a change. I now have to approve new members. That's right. So I can control the environment. If I see an account that signs up that looks suspicious, I'm not going to approve it. Okay? But with people telling me that, oh, they're going to be leaving Twitter, I'm seeing comments of it, I should say, of people saying they're going to leave Twitter. By all means, you are more than welcome to sign up and make a account on my website and become a member and start posting. I just asked one thing. Just make sure you use the same username that you're using on Twitter, or if you follow me on Counter Social. That's another place where I do post this daily pandemic update. By all means, just use the same username. That way we know who you are. We know who you are from Twitter. And who knows, maybe we'll have discussions going within these articles. We'll have ongoing discussions, and, maybe it can turn into something. Because as of right now, again, I'm not leaving Twitter, but we'll just see where this leads to down the line. If it looks like there's going to be a mass exodus, by all means, you'll be able to find me right here on my website. That is datareport.info. It'll be in the description down below. Alrighty, guys, that does it for today's pandemic update. We will have another pandemic update again tomorrow. If you like this update, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you want to join in on the conversation, join in on the comments down below, or sign up to become a member of my website, datareport.info. By all means, you can share this with anyone who needs to see this video. I will see you all again next time. Until I see you again next time, two things. Number one, do not take part in any super risky activity this weekend. Do not go to any concerts. And by all means, just stay safe and have a great weekend. See you all next time. Thanks for watching.